New Zealand's health minister has now resigned following a series of personal blunders during the coronavirus pandemic. David Clark has faced intense criticism for his handling of the pandemic and also for violating lockdown rules of the country. Clark was earlier demoted after breaking the country's strict lockdown rules. In the first week of the lockdown, he drove his family to the beach. Listen in to what the outgoing health minister had to say about his resignation.
No secret that health is a challenging portfolio. I have given it my all. But it has become increasingly clear to me that my continuation in the role is distracting from the government's overall response to COVID-19 and the global pandemic.
Prime Minister Jacinda Ardern has also accepted his resignation now, saying that it was essential that the health leadership has the confidence of the New Zealand public.
Last week I had discussions with Dr. Clark. We talked about how important the COVID response was and the need for that to be our primary focus as a government, as a cabinet and as ministers. He reached the conclusion his ongoing presence in the health role was causing too much distraction to the government's ongoing response to COVID-19, an assessment I agree with.
New Zealand's dealing of the pandemic has been hailed as a success story. Last month, the country had declared it was virus-free, with all the restrictions being lifted. But just a week after that, 3 new cases emerged in the country. 2 people were even allowed to leave isolation early without being tested. They then later tested positive for COVID-19. This led to heavy criticism over the handling of border and isolation facilities in the country. Ardern has now appointed Education Minister Chris Hipkins to temporarily take over the role.